Hello guys, how we doing? Hope you're keeping safe, hope you're keeping fit. It's Dr. Din here with you once again. So today I'm going to be talking to us about diabetes mellitus. What is diabetes mellitus? Diabetes mellitus is a metabolic condition whereby there's excess glucose or sugar in the blood as well as in the urine. What happens is that there is a deficiency in the functioning of insulin, either because the insulin is not enough or the body is not responding to insulin. Now, when you eat food, whatever the food is, pasta, carbohydrate, protein, as in chicken, milk, fats, whatever it is, cheese, the body breaks it down to glucose. Glucose is the form that the body needs to supply energy for basic metabolism in the body, like the functioning of our heart, the way the heart is pumping and all that is glucose that the body breaks down into a factor called ATP that is used to generate energy. Now, when you eat and the body breaks down your food to glucose, the body only takes some part of the glucose. Most times the body really doesn't need everything that you have eaten. So the body takes a part that it needs, and the remaining part is converted, is mopped up, so to speak, and converted into a storage form by the hormone called insulin. And this is stored in the liver and stored for future purpose, when you need it, they can call for it and it's broken down again to glucose and the body uses it and all that. Now, what happens in diabetes mellitus? This hormone insulin is either deficient or is present, but the body is just not responding to it, which is what we call insulin resistance. Now, what happens now when the insulin is deficient or the body is not responding to insulin? There's excess glucose in the body, glucose that the body doesn't need, in the form that is toxic to the cells of the body. So you might be wondering, if glucose is excess in the body, after all, they say the more the merrier, should that be a problem? But in this case, it's a big problem. The reason is because when the cells of the body are, battered in excess glucose, it can be toxic to them and the cells start malfunctioning. Excess glucose can affect the vessels of the body, the blood vessels that carry blood to the brain, to the heart, to the kidneys, to the limbs, our legs, and other parts of our bodies. And it's toxic to them and can result in disease conditions such as stroke, a heart attack. It can affect the kidneys. It can result in what we call diabetic foot ulcers that can result in loss of limb. I've seen a lot of patients who have lost their limbs as a result of complicated diabetes mellitus. So you can see that just from having excess glucose in the body, the kidneys are shutting down, the heart is shutting down, the limbs are going. Now, it's important to say at this point that diabetes mellitus is not a death sentence. I've seen patients who have been diabetes for 30 years, 40 years, and they are doing fine. They are doing really well because they're doing regular checkup, they are adherent to their medication, their prescription, and they also believe that they will do well. They have hope. So, what causes diabetes mellitus? I've seen people tell me that or ask me, doctor, how come I'm diabetic? I don't take sugar, I don't take soft drinks, I don't take soda, I don't take juice. So why am I diabetic? And that's because they think that diabetes mellitus is caused by taking excess sugar. Although taking excess sugar, taking a lot of junks can aggravate it, can make it worse. Or if you're already predisposed to having diabetes mellitus, it can make you come down with diabetes mellitus faster than you're supposed to come down with it. But diabetes mellitus is not caused by intake of sugar. Diabetes mellitus is genetic. It's genetic and hereditary. So that's why people with family history of diabetes mellitus in the first degree relatives, like their parents, their siblings, have the risk of coming down with diabetes mellitus. Now, is it everybody with the family history of diabetes mellitus that comes down with it? No, not everybody. It's just a risk. It's just a probability. Now, when two people have the same risk of diabetes mellitus, one may develop it and the other one may never develop it. This may be because the person that doesn't develop it is putting in lifetime modification, is introducing lifetime modification to his diabetes prevention. For example, an individual whose parents are diabetic, but who is not exercising regularly, who is taking junks, living a sedentary lifestyle, probably taking steroids, using steroid containing creams for lightening, for bleaching and all that, that person is likely going to develop diabetes mellitus faster than the other person. So the fact that you have that family history doesn't necessarily mean that you're going to come down with diabetes mellitus. Also, there are other things that we call secondary causes of diabetes mellitus. There are some syndromes that can cause diabetes mellitus, but the difference between the regular diabetes mellitus is the fact that when you're able to treat the underlying cause, the poor glucose control, the high blood sugar disappears. For example, some people can have transient elevation in their blood sugar as a result of maybe they have been on steroid cream or they have been on steroid containing medications, maybe for one condition or the other. Their glucose level can go up. Some syndromes called Cushing syndrome can also result in elevated blood sugar, and things like that. So now, what are the symptoms of diabetes mellitus? What are the symptoms that you can see and say, I need to check my blood sugar, I need to go to see the doctor to check my blood sugar? 1, excessive thirst, excessive urination, especially at night. Maybe you've been urinating once at night and now it's getting to you get up 2, 3 times, 4 times to urinate. It might be a sign or a symptom of diabetes mellitus. Also, you may start developing boils all over your body as a sign of reduced immunity, because diabetes mellitus has a way of reducing the immunity so that little infections that you will not necessarily get will start coming up. Also, lifetime modification such as exercise, dieting, and all that. What we do is that, especially for people that are predisposed to it, maybe they have family history of diabetes mellitus, what they do is that they slow their, or let me say, reduce their risk of coming down with it. It's not everybody that has the risk of diabetes mellitus, or that has a family member, maybe a mother, a father with diabetes mellitus that comes down with it. The genetics has to come together with the environmental factor. Environmental factors are our lifestyle, the kind of life we live, maybe sedentary lifestyle, maybe we take a lot of junks, we take a lot of fast foods and all that. So when those lifestyle habits now come together with genetics, it makes it faster and it increases our risk of actually coming down with it. So in my next video, I'm going to be telling us about some of the complications of diabetes mellitus and how we can prevent them. And I'm also going to be talking to us about what to do when you already have diabetes mellitus, how to live with diabetes mellitus healthily without having any issues, how to live a healthy life, how to live a good life having diabetes mellitus, and living a long life with diabetes mellitus. So this will be all for today. Don't forget to subscribe to our channel. Just click on the button and subscribe. We are here because of you. If you're not here, we won't be here. So, like I always say, I like to hear good news about you, about how you're faring well, about how you're taking charge of your health. Stay blessed and stay fit and healthy. Bye-bye.